Good evening.
I'd like to welcome you all to the inaugural HIFU Users Group Meeting. I think it's an exciting time actually for this technology. We've got a few people missing as yet. I think everyone's running a bit late, but I think we should make a start. This is an exciting time particularly to be involved in HIFU technology, particularly with the advent and expansion of focal therapy. And it was quite interesting actually. Myself and Hash were looking through the EAU website last week, and they've asked for fellowships related to focal therapy, centres which can offer fellowships in focal therapy, which I found very interesting. And I think this advent and the expansion and the embracing of focal therapy, particularly in Europe at the moment, and probably less so in the UK, is certainly going to help these minimally invasive interventional technologies which are available. We've got a short program of eminent speakers tonight. I'm actually going to change the timetable a bit. So I'm just going to talk while I'm here about the HIFU registry for a few minutes, and then we'll go on to the program as it is on the timetable. So as regards the HIFU registry, I think we're all putting data for the purposes of research, for audit, and also to comply with NICE guidelines onto various databases. However, NUADA Medical Foundation, that's a registered charity set up by NUADA, have kindly sponsored a national UK HIFU registry. This is a very secure site which any one of us can enter data onto, either using iPhones, iPads, your desktop, and it provides a national resource both for research and audit, and as I said also, very importantly, to comply with the NICE guidelines. Our approximately 1,600 cases which we've got on our database at UCLH will be transferred to this registry in the near future. And I don't know whether Neil, do you want to make any comments about the registry which is set up? Neil's one of our, the main database manager at UCLH, involved in many of our trials. Do you want to say anything about, because you were involved in setting it up?
No, I know I sort of handed back the registry to a lot of the sites from 2012. It's sort of mushroom, and there's a lot of data, and I can say 16 cases, so I control it like 11 it's really interesting to see if archaeology consultants are still entering the data in a new format, which I think is really promising.
Yeah.
It would be a much better avenue to input the data than we did previously.
And the points I think that are actually on the website are actually the points which NICE have asked for as regards pre and post treatment and intraoperative treatment. So although actually there's a bit to fill in, which we may get help with in future as individual surgeons, everything which is requested on the website are actually points that NICE have asked for.
I think you can't underestimate the power of the registry as well. I think NICE dictated that the data had to be in the registry or in a clinical trial for safety of the patients. And I think with the data going in, especially the HIFU, is still relatively a new technique. It started in 2004, some surgeons in 2009, or even later, and it is really good to follow up these patients and make sure that they stick to the track, because PSA kinetics and follow-up with these patients is still going to know how it should be done and take the trouble points off or treatment data.
Yeah,
Is the space-based mandate, is there a minimum requirement in terms of follow-up, in terms of the, obviously PSA is very easy to do, but is the amount of time we're putting patients on the database, should we at least do a biopsy at some point, should we at least do a scan at some point, are there minimum things?
So there are follow-up criteria on the database. However, they're not limitless as such, but I think we would encourage you, as you're following up these patients, to continue to put on the data, because if I'm going to talk about it in a minute, we will have an independent oversight committee looking through the registry and auditing it at a regular point. That I think, although the follow-up is short on the registry, but we would encourage everyone to continue to put on their data as they collect it in outpatients and such.
I guess what I'm saying is that I got, the first patient in Southampton, I did, so far so good, everything was great, and he had a good response in his first scan. And I said to Carol, when I saw her the other day, I'm going to plan to do a biopsy in the spring. She goes, to be honest, everything's looking great. I'm off trial, I don't really need to do a biopsy, and well, I love that. It's not mandated. Is that okay? Or is the registry going to be upset?
Because you didn't put that data on it.
Am I going to be then like compromising my sort of compliance by not doing it?
There are two sets of criteria. The NICE guidelines don't call for a follow-up biopsy. They're looking for PSA kinetic as being a guide to whether you do one biopsy. But the index trial may call for another biopsy. And I don't know because I haven't seen that published data yet.
So if we're treating off-trial patients, we can fill in the biopsy data if it's there, but if it's not there, we're not going to be struck off.
No, I mean, obviously, you won't be penalised. But, at some point, we're all going to... I think at some point, we're all going to use the registry to publish data on. And I think the longer follow-up there is on the registry, the better for us all.
I think having collected data about particular nine sites as well, if we try to be too regimented and have strict criteria for the follow-up, just wouldn't work. Every time we actually operate differently, as Manit said, the PSA, or as you said, the PSA is always stable. It's not that I'm not able to bring any of the feedback and based on the data that I've seen across.
So as I mentioned, there will be an oversight committee regularly auditing input of data into the registry, making sure it's complete. And actually, we asked for nominations for that. So there were multiple nominations for the following candidates, if we all agree. So we needed a urologist on it, so Hash Ahmed. We needed a database manager, Neil McCartan, and also an independent, i.e. someone who wasn't using HIFU. So Paul Abel has been nominated for that, if everyone's happy with that. Great. So, just one last thing before we go on to our list of talks. So, I'm just going to mention now the HIFU Users Group Committee, which someone's going to talk about it. As regards the HIFU Users Committee, we asked for nominations for that, and again we had multiple nominations for the following candidates who will be on the HIFU Users Group Committee. So there's Hash Ahmed, he's obviously very popular. There's Tim Lana, Raj Prasad, Richard Hindley, Vic Griffin, Tom Leslie, Simon Bott and myself. So initially that will form the HIFU Users Group Committee, but we will rotate this as the group gets bigger and we're more proactive. And I would certainly hope that we would use this Users Group Committee as a platform to discuss issues in training, national guidelines for HIFU, focal HIFU, and we can take it forward from there. So I'd just like to now go on to the list of talks. So the first